Good morning, everybody. Thank you all for coming. I'm very proud to be standing here for this announcement. I will begin with some introductory remarks. Sheriff Michael Ash will speak. Dr. Mark Kerouac and Dr. Robert Roos, who's to my left, will also speak. Since taking office last year, I've spoken to many residents of Hampden County touched by the issue of addiction. I've talked to mothers and fathers of people facing addiction and seen their anguish and pain. I've talked with those who are facing addiction and seen their struggles and their challenges. And I've talked with colleagues and friends in law enforcement, in the public health sector, and other places who have seen frustration, who have seen challenges, and were motivated to take action. We realize that fighting this opiate epidemic with a unified front is a moral obligation for all of us. We cannot reactively treat, prosecute, or merely incarcerate our way out of this addiction crisis. Through education and prevention, we can equip our residents to recognize addiction. With the appropriate treatment, we can assist those afflicted with this disease. And we understand it is indeed a disease. I am proud to stand here today with many members of this task force, many of whom stand and sit to my right. Some are not here today. They, in many cases, have been working on this issue for years behind the scenes, for years in places where there was no attention, there was no media, and we're proud of their work to this point. They have been on the front lines of the fight against addiction and have brought awareness to an issue that has been long misunderstood. Additionally, I am exceedingly proud to stand here with Hampden County Sheriff Michael Ash. Sheriff Ash has been a pioneer in law enforcement and someone who for a very long time has been at the leading edge on the issue of addiction and treating those afflicted with this disease, both with effectiveness and compassion. Several months ago, the Sheriff and I met with Dr. Mark Kerouac, President and CEO of Bay State Health, and Dr. Scott Wolf, President of the Sisters of Providence Health System. We all, separately and independently, prior to those meetings, and through the lenses of our own professions, realized the need for unity of effort across professions and traditional boundaries around the issue of addiction and its treatment. Together, we all agreed that we need to bring together those working on this issue and intensify our prevention and education efforts as a coalition. They pledged their support in their respective institutions' commitment in this fight. Together, the Sheriff and I are leading this effort to create a hub to combat the addiction and opioid epidemic. This task force we're announcing today signals the paradigm shift in law enforcement and the healthcare sector here in Hampden County and throughout much of the Commonwealth around the understanding of addiction as a disease, its root causes, and the necessity of treatment, prevention, and education. The Hampden County Addiction Task Force has put forward a mission by which we will operate, and the mission statement is as follows. The Hampden County Addiction Task Force is a collaboration of community resources, law enforcement, healthcare institutions, schools, service providers, and community coalitions whose goal is to focus on a county-wide approach to address drug overdoses, addiction, and prevention and education. We have specific and measurable goals, which I want to highlight and underline for all of you to understand. And these are the objectives initially that we will focus on and we believe we will achieve in short order. Those goals are as follows. Real-time data collection here in Hampden County. The goal of studying, assessing, and specifically estimating the need for a treatment capacity and beds in Hampden County. To develop and standardize messaging for addiction and addiction-related issues across the county and across our various sectors. To provide a forum for law enforcement, healthcare institutions, schools, service providers, and community coalitions to share best practices in prevention and education. And 5, to leverage existing assets in seeking out new funding opportunities countywide for addiction prevention and education. We entered into this effort as a task force and as individuals committed to this work, realizing we won't stop addiction, but we will and we can bring awareness and understanding of the issues surrounding addiction, collaborate with one another on the best ways to utilize and maximize resources, and educate our young people on the dangers of drugs, both illicit and prescribed. I am honored to be a part of this effort. I am honored to usher in what I think will be a critical piece of our work in Hampden County for the years to come, and eventually looking back at this period of time with sadness, but also with a sense of accomplishment, that it is something that is in the past, that we have gotten over. We'll never completely beat addiction, let me be clear. But we can work on it, we can be more effective, we can be more compassionate about the work we do, and ultimately make a real difference in people's lives. I'm honored to introduce Sheriff Michael Ash.
Well, thank you, Mr. DA, and again, thank you for your outstanding leadership and, as I call it, a visionary leadership in terms of bringing us all together. And I think we constantly hear that word, community partners, and unifying everybody. And again, not just as a law enforcement aspect, but I'm very, very proud of Anthony. So well put and so deliberate, very, very thoughtful, and so on. As you all know, that 90% of the inmates that I have at Hampden County Sheriff's Department, if you will, come there with substance abuse issues. And as we know, particularly with the mandatory minimums, you and I know we can't build ourselves out of this situation. And that's why I'm so proud of Anthony's leadership here. And I call it a visionary leadership in terms of stepping up and really attempting to bring us all together. And you saw not only law enforcement, but the medical centers, the nonprofits, the schools, et cetera, et cetera. It's just wonderful, and so on. I have also said that substance abuse is the determinant or the foundation deficit for those in my custodies. And you and I know if someone obviously is able to confront their issues, they're not going to be coming back to the jail time and again. And that's very clear. We've seen this over and over again, because one of the things I'm proud about in this aspect of community corrections, if you will, is that we've been able to reduce the population by 35%. So you can see the medical institutions, the nonprofits are all stepping up, if you will, and united behind this. Okay? Now we have this new visionary team effort led by District Attorney Gallooni to involve law enforcement, what I call community partners, to continue this fight to battle addiction. And I just wanted to highlight the community partners. And of course, as we know, and I like to feel about community corrections, that I've had over 300 partners that have been able to help the Sheriff's Department, not only in fact of incarcerating people, but the whole aspect of forming that strong bridge back into the community. And that's been the impact in terms of recidivism. So all Sheriff's Department vehicles say, united neighbors make safe neighbors. Let me give all of us a variation of that. A united community concerned with the well-being of all is our greatest weapon against drugs. So thank you, Anthony, for your great leadership, and I call that the visionary leadership. You know, very, very proud of you. It's something very, very long. Thank you. Glad to be part of this. Yeah.
Thank you, Sheriff Ash. Dr. Mark Kerouac, President and CEO of Bay State Health.
Good morning, and let me add my thanks to District Attorney Gallooni's strong leadership in bringing together all the necessary pieces for us to combat this really urgent public health epidemic. I also want to thank Sheriff Ash for his decades of leadership in advancing a humanistic view of addiction and a disease model of addiction, which I think is the right one. And I'm proud to stand here with Dr. Roos and our other colleagues from the community and lend Bay State's support to this important initiative. I've had personal experience in 20 years of caring for patients with HIV and AIDS and dealing with the heartbreak of addiction and how it affects families. And one needs to only go to our emergency departments or our many sites where we care for a large share of the Medicaid patients in this community to know how deeply this problem has affected the communities of the Pioneer Valley and my hometown of Springfield. I firmly believe that it's only through a partnership with emergency responders, law enforcement, the clinical care delivery efforts, as well as the community providers who deal with so many of the social determinants of health, that we can finally get this behind us and get moving. I'm very, very pleased to see District Attorney Gallooni step forward, because I now believe that we have the right pieces in place and the right structures in place to really combat this epidemic effectively. So thank you all for coming today.
Thank you, Dr. Kerouac. I'll introduce now Dr. Robert Roos, Vice President of Addiction and Recovery Services with the Sisters of Providence Health System.
Good morning and thank you. It's my pleasure also to be here and to represent Mercy Medical Center and Providence Behavioral Health Hospital, as well as the substance use prevention, intervention, treatment, and other providers throughout Hampden County here in the greater Western Massachusetts region. I want to commend and extend my gratitude to DA Gallooni and Sheriff Ash for their forward-thinking leadership and bold actions, for convening and leading this dynamic task force right here in Hampden County, the heart of our region, as well as for their sustained commitment to this important issue. Addiction, inclusive of any and all substances, is the single greatest threat to individual and public health and safety. Addiction is the leading cause of preventable death and illness. And we all know too well that drug overdose is the leading cause of accidental death in our state, far surpassing motor vehicle accidents and gun violence. And so it's clear, and no surprise to any of us or to you here, that we still are a county and a state amidst a crisis. The statistics are striking, and addiction has spared no one. It's affected all of our communities as individuals, family members, colleagues, employers, employees, providers, and professionals. And so in my role as a medical provider, as well as a vice president of the Sisters of Providence Health System, I have the privilege every single morning of treating patients with opiate addiction, Monday through Friday, starting at 7 a.m., including this morning, to witness the struggles in accessing care, as well as the transformation that can occur when an individual can initiate and sustain life-saving treatment for opioid use disorder. But I would ask all of us collectively, wouldn't it be nice if we lived in a place where substance use was not the leading cause of preventable death? Wouldn't it be nice if addiction were identified and treated as well or better than any other chronic illness? Wouldn't it be nice if all healthcare, treatment providers, social service, and other agencies treated addiction as a disease worthy of high-quality intervention and not judgment or marginalization? Well, I'm proud to say that here at Hampden County Addiction Task Force, we believe that not only would it be nice, but it would be right. And that's why we're here today, together, as a task force. Over the last 18 months in Massachusetts, there's been a number of initiatives, programs, and developments, and legislation passed. We've seen the launch of public education campaigns on behalf of the Department of Public Health, as well as local media outlets, with the goal of raising awareness on the impact of opiate addiction, as well as ways to prevent it. We've seen efforts on behalf of the Massachusetts Hospital Association, our local hospitals, including Bay State Health, Mercy Medical Center, and others, to increase the education of medical providers. Because medical providers played a role in the initiation of this crisis, and ways to appropriately treat pain and adopt policies to temper the prescribing of opioids and to counsel patients on safekeeping and disposal of unused medications. We've seen legislation passed that has removed prior authorization requirements for inpatient treatment, and we are continuing to see the expansion of treatment capacity throughout Hampden County and greater Western Massachusetts. There's been an increase in the ways to obtain and use the opioid overdose reversal drug naloxone. And with recent legislation, efforts to limit access to prescription opioids, increase education and prevention, and mandate evaluations for individuals who present to a healthcare facility after an opioid overdose. And collectively, these myriad efforts have made an impact. But we're here because we know that we still have some more work to do. Because on the front lines, treating patients and assisting them in their recovery is an incredibly privileged place to be, but it can also be an incredibly challenging place to be. I also get to hear firsthand the struggles it can be to access treatment, the long wait lists, the fragmentation in the system of care, the medical and psychiatric symptoms, the threats to individual and public safety, including violence and crime, and the difficulty accessing employment and the experience of stigma. I believe that we would not allow the impact of addiction to be so wide-ranging and devastating if it were treated the same as other chronic illnesses. And we have, as a community, stepped up and believe that we can do better, and that Hampden County can be a leader. Addiction is without a doubt a biopsychosocial spiritual disease that impacts all dimensions of an individual's health and all sectors of society. And so the solutions must come from all sectors of society, including all of us on the Hampden County Addiction Task Force and in this room, working each and every day on prevention, education, treatment, harm reduction, public safety, public health, social services, policy reform, corrections, and jurisprudence. We all are in our own ways on the front lines, and with this crisis has come a renewal of collaboration, commitment, and transformative action. Significant strides have been made, but we continue to have a great opportunity to do so. In this field, there's an old mantra that the natural course of addiction will only lead to 3 possible outcomes: jails, institutions, and death. Well, we at the Hampden County Addiction Task Force believe differently. We want to change that. We believe that prevention is key, treatment does work, and people can and do recover. The Hampden County Addiction Task Force and the many individuals and organizations that it represents, under the strong leadership of DA Gallooni and Sheriff Ash, hope to continue to give our community a chance to prove it. Thank you.
Thank you, Dr. Roos. I think you can tell we have a remarkable coming together of resources and people and commitment here, and I am tremendously proud and privileged to stand here with 3 great people representing 3 great institutions. And the work is yet to come, and we're very confident it will come with great success. So I'm happy to take any questions the media